Hello and welcome back. Unfortunately, as Pete said, one of our guest presenters was unable to present for this session. So I'm going to present a little bit more on AI. One of the things with this presentation, and I think one of the earlier presenters mentioned they're at the Digital Health Festival last week, was I actually attended the Digital Health Festival and presented on AI with a real focus on general practice. But I think that, when you start to think about artificial intelligence, there's certainly an opportunity in allied health as well. And the same principles and the same approaches can be carried over. Now, I know we've had some amazing presenters already. We've had a discussion on AI, but what I'm going to talk to you about is not in detail and about the tactical kind of parts about AI, but more the strategic pieces that you can think about when looking at AI. Now, when you start to think about AI, it's a big, scary word, and most people think about AI in terms of a robot, and they think about that end goal. You've heard about ambient scribes this morning, but when you start to look at, when you speak about in general public, they think that, it's robots, it's all around artificial intelligence potentially taking over the world. You've seen a lot of movies, I, Robot, and all of those types of things where, artificial intelligence kind of becomes this big and beast thing. And when you think about it, there's so many terms that are thrown around when you think about AI. So it can often become overwhelming, and you can often become, confused around what are you looking for, what do you want? And when as I said, these are kind of a word clouds of all the different words that are mentioned. You have artificial intelligence, you start to think about machine learning, chatbots, you think about clinical decision support, generative AI, LLMs. There's also a lot of scary words that are thrown around. So data privacy, governance, bias, ethics. So when you start to, particularly as an allied health provider and as a small practice, you start to think about what do we do? What direction do we go with AI? What is safe? How do I apply it? And I think that that's one of the really big challenges that the PHN is starting to see as we progress AI. The curve for AI, and I suppose that implementation curve, is that it's rapidly changing, and that if you think about the evolution of mobile phones, and that was a sort of a slow curve, and then I think about our smartphone. It's got AI built into it. It's everything that we do so much on a smartphone. But AI, the growth of AI, and the rapid implementation and adoption of AI has just been next level. And that curve of implementation and use is just, it has gone next level, I suppose. And it's something that we're probably not used to. We're not used to the rapid change. We're not used to, things like legislation and laws and around it, and the safe use of AI hasn't kept up with the evolving external environment. One of the things that you start to think about AI is that it's not going to take over the world. And I think we just need to be very clear is that, AI is really, it's more than robots, but it's really an enabler. So AI can be used, and you've heard many conversations today around ChatGPT, ambient scribes. It's an enabler to be able to support your practice and your business to be able to do things more efficient. It also helps with improving sort of patient experience and looking at the patient experience, creating efficiencies, but it allows you to be able to focus on value-added work. So whether it's your support team that work around you, whether it's in a clinical sense, AI is more than robots, and it's very much that a pathway to be able to support it. Now, as I said, it's quite overwhelming when you start to think about artificial intelligence and you start to talk about it. And one of the reasons it can become so overwhelming is the fact that there are there are sort of different types of AI. So when we start to think about artificial intelligence, you have narrow AI, and then we move through to generative AI, which is our most commonly used form of AI. Narrow and generative AI are the two most commonly used types of artificial intelligence that we use in our everyday life. Thinking about your smartphone, I don't know how many people, and if I could see you in the room, I'd ask, how many people have had their latest iPhone start to talk to them with a bright, beautiful rainbow coloured around it, where it's listening to what you're doing, and then it actually, that's artificial intelligence. Your latest smart iPhone as well, if you look at any of the, if you go into a photo and you can edit your photo, that is artificial intelligence in the background. So I'm not sure if anyone's done that, but if you go into your iPhone and look at your photos and edit, there is actually an ability to remove images out of that background of that photo. That exists in that generative AI space. Then when you start to think about the narrow, it's where we start to think about some of those things like chatbots and those types of things that exist already in our everyday lives and in our existing systems. Autonomous AI is really that smart AI, and it's really around that sort of next level. This is really where you start to think about so those robotic processes. It's often used a lot in, I suppose, manufacturing. It's used in, if you think about Amazon, I don't know if anyone's ever seen videos of the Amazon warehouse. A lot of that is where the autonomous artificial intelligence comes into play. And then the final one is really this general AI, which is strong AI, which is that futuristic type of AI. There are, if you look online, there's a number of different videos where this is emerging. We're not quite there yet, but there's a lot of people trying to crack that. And thinking about, I think recently there was a story, I think it was on 60 Minutes, of a sort of a humanoid robot where they interviewed, and they could sort of talk to us, like they could answer questions, they could respond, they had thoughts, they had feelings. Ironically, it's still not in this general. That was still in that generative AI space. So the reason I'm showing you this is to be just so that you know that when people talk about artificial intelligence, there's kind of there's a few more, but there's really 4 buckets that people are talking in, which is why it can become so overwhelming. But when I start to think about AI, is that one of the things that we need to think about is that some of the challenges with AI is looking at things such as cybersecurity, privacy. That's one of the big pieces that we really need to consider. And I know some of the presenters have already talked about it, but it's one of the critical pieces that we do need to think about. Thinking about cost and affordability. The cost of some of the artificial intelligence solutions, like the AI solutions, are quite expensive. And what that means is sometimes it's prohibitive for practices that are smaller and not able to afford it. And I know we've had Lyrebird here, but if you think about the more you keep adding in, it's a month-on-month subscription cost. So that does start to sort of blow out, and it gets quite expensive. And I think that the final one is around is around how we can make sure that we are safe in terms of using it, ensuring that that it's safe and it's adequate, and we're asking for consent. So the consent component is if you are using AI in a clinical sense, and you are using it to, if you're using an ambient scribe, or if you're using a listening tool, you do need to make sure your consent is there, and make sure that that's built into how you change and adopt that within your practice. Always ensuring that you're very clear that you're using that tool. Sorry, I'm having trouble with the clicker. Now, there is a lot of bad news in the media around artificial intelligence, and these are 3 examples that I have pulled out from the internet. But if we're thinking about the facial recognition, so in the UK they have cameras that are set up, and they have facial recognition that sort of sits across that. Can you imagine where that could be used to do racial profiling, or being able to profile a person to say that they potentially will do a crime based off information that's contained in AI, so where the information's coming from. And that's where there's one of the concerns that comes out quite often is around bias, and around where there's source information that it's getting data from. So that is one of the really big concerns. There's another concern, I suppose, around is start to think about toys that, are delivered for children, and that the ability for them to be able to capture information and learn from the environment. And then the final one is there is a growing trend of deepfake clinical professionals. So either doctors, allied health professionals. I'm not sure if anyone looks at TikTok, but you always see online, I am a professional this, and this is how you do things. Quite often it's the same face, they just have a different role. One could be a specialist in an area, and then the other could be an allied health professional. So it's the same image, it's the same voice, but that's all generated as a deep fake through artificial intelligence. And there are news articles, and you can see the stories, and we can share this pack, but there are links to where this information is coming from. Now, I've kind of shared with you the bad news stories, and I feel that I use AI in a lot of things that I do. Copilot, ChatGPT. I love my iPhone, where I can take away the background and make my photos look much better. Don't like going down that influencer path, but it's always one of the things that you like to make sure that you have the best. You're making use of it. At my heart, I'm really I don't want to say a techno geek, but I love technology. And I do see that in practices, particularly in allied health practices, there's so much opportunity in this space. So one is around streamlining processes. So using artificial intelligence to be able to take away some of those repetitive tasks that you don't necessarily need a person to do. So one of my previous roles prior to joining the PHN was that I did work for New South Wales Health, and I worked for one of the shared service organisations, and we looked at how we could put in digital workers, which were a form of automation, but had some level of artificial intelligence over the top, to do some of those repetitive tasks. So things like debt recovery, accounts payable. So there are tools out there that you can do that with. I think the big one is patient communication, and patient communication, having a look at chatbots, automated conversations. There was a discussion earlier about having your practice information on your website and information. But could you imagine where you had the ability to have somebody make a call to your practice and say be answered by a humanoid sounding robot that could answer questions. Be able to make bookings. These are realities that do exist, and I've seen a couple of examples at the Digital Health Festival that I think would make a real difference. And I think the final part is around that, enhancing improving and enhancing patient outcomes. So things like everyone wears a smartwatch these days, and smartwatch captures a lot of data on what you do, how many steps you take, your heart rate, your temperature. A lot of the background and a lot of the analysis is generated by AI. There's a lot more opportunity, and there's a lot of startups and a lot of technology, like health tech, starting to be developed to be able to support that. And if you think about patient outcomes, and you think about if you were to bring two types of technologies together, for example, maybe an augmented reality solution for patients that are in a remote area, along with an artificial intelligence kind of background that could customize a kind of a plan for them, and you could manage that way. That would be a game changer for patient outcomes. So there's a lot of opportunity in that space. It is evolving, and when you start to think about when you're working in a clinical sense, the things you really have to think about as well in that space is ensuring that it has the right level of approvals, like TGA approvals, ensuring that you have the right privacy concerns and that all the data is stored in Australia. So AI, there's so many opportunities here, but they're the things that we start to think about when we go down in that clinical sense. So the first two are very much practice specific, and in a business, looking at it more operational. But when you start to move down to that third bucket, they are things you unfortunately have to consider. At the PHN, you may have noticed that we last year launched an AI-enabled general practice initiative. And part of that initiative is to be able to capture some of the data so that we can actually look at putting out a safe AI use guidelines for general practice, for allied health. So therefore that can help you with making some of the decisions. It's something that we are continually looking at, how we can expand that and how we can actually support different primary care providers in this space, because we do understand that it's constantly changing and it's very hard to be able to stay across what those changing environments are. So we really are looking at how we can best support you with this space. Our Digital Health Essentials is a piece that we will be updating around this, particularly for allied health, as this evolves. Now, I have kind of touched on a little bit here already, but when we start to think about the good, there's always the ambient scribes, which we've spoken about. We've spoken about, ChatGPT, but we've also started to look at, there's artificial intelligence being used to things like dementia, so dementia detection, and those types of things. So there's a lot in this space that is evolving. It is constantly changing, and I think that, it is the future. And there is a lot coming down this space, and we will sort of move through that peak at some point, and this will become much more normalised, but this is certainly, there's a lot of opportunity. We kind of have to just look for it. So when I start to think about key takeaways, AI is very broad, it's very complex. Don't be overwhelmed. It's not something that, if you're looking at it, please don't be scared and don't be overwhelmed. The PHN, we can always support you, with information on it. Make sure that you do your research. Make sure that you are that you understand the risks. Understand the risks, and be able to look at, how do you manage those risks, and things like information, privacy, data. Those are the types of things you think about. How you make sure it's safely used. I think the one key thing, and this has been touched on today, is never forget about the human experience when using AI. And when I think about human experience, it goes back to that original slide, is that it's not about robots. AI is there to be able to support you, enable you, and give you back more time. But at the end of the day, it's never going to replace a person, and it is very much around being able to provide that support. And if you do put AI in, is that it's meant to enhance the experience when you're dealing with your patients, making sure that you never forget that. I think finally, there is really opportunity for AI in your practices, but you need to work through the hype and determine what is best for you and your patients. And I no disrespect to any vendors that are out there, but there is a lot of hype around AI, and it's really understanding what you need, how you can use it, and how it's going to benefit. Don't get caught up in the sales pitch, but do your due diligence, understand what it is, and certainly look at exploring it. Start small, testing it, and if anyone has never played with ChatGPT, please go and have a go play with that ChatGPT. My mum loves it because I always use it to write amazing birthday cards, amazing messages, and I think that, do it in a safe environment. You do it for yourself if you've never used it and you're a bit scared. So start to look at how you can use it, and just make sure that you are considerate about what you do, and the PHN is always there to be able to help. Thank you very much.